Thank you, Dave. Now, summer may finally be here, but for 1 in 10 Irish people, the warm season also brings with it onset of itchiness, sneezing and overall runny noses.
Yes, Dr. Dermot Nolan joins us this morning with some top tips on keeping hay fever at bay this season. Good morning to you, Dermot.
Morning,
Thank
Dermot.
you for joining us. Can we talk about hay fever, what it is first of all, and who it affects, Dermot?
Well, it affects between 10 and 20% of the population, and there's been an explosion in hay fever and allergies generally in the Western world in the last 20 or 30 years. And how it affects, basically, it's an allergy to pollen. And there's 3 types of pollen. There's tree pollens, and these are the patients who tend to get their symptoms very early on in the summer. Then there's grass pollens, these are the ones that get in the midsummer. And then there's molds and funguses later on. So there's 3 groups of patients. And typically how they affect it by is sort of itchy eyes, runny nose, blocked nose, itchy throat, and although it can be a very mild and sort of somewhat trivial illness in some cases, a lot of patients will get it really, really severely, and it really will make their life misery for the whole summer.
Yeah, that's a word that you hear very often, people who suffer hay fever. It's a misery of a disease.
Yeah.
Because your eyes are running, they're itchy, you're scratching them, your nose is running.
Yeah,
But
yeah.
you say one sort of general piece of advice is that if you are taking anything for it, that you need to start the treatment early. So if you suffer with it in June, start treating yourself in May. Now, a lot of hay fever sufferers would have a daily routine anyway, wouldn't they?
Yeah, I think they will. But one of the nasal symptoms are the ones that really annoy patients. These are the ones where the blocked nose. And if you wait till your nose is blocked, trying to use sprays, etc., really is a waste of time. So what we try to get patients is, and they often say, listen, my symptoms usually start around the 1st of June. So we try to get the symptoms, to start the treatment early. And it's interesting even talking about how it affects it. You're right, absolutely right, how the misery the patients affect. But also there's a sort of a series of side effects. It's coming up to exam season. And it has been shown that students drop an average 1 grade when their hay fever is bad. So we look at what they do in their summertime or their mock exams, and then the summer exam, they drop on average 1 grade, and that's because they're probably not sleeping very well at night time. They're blocked up, they can't concentrate, etc. And so it's really important, with exams looming, that this is taken seriously and treated properly.
So we need to get ahead of it almost.
Yeah, I think
now,
so.
lots of people will reach for the nasal spray, and you were telling us before we came on air, Dermot, that lots of people are using it incorrectly.
Yeah, I think that's one of the big problems. Firstly, that maybe, as we said earlier, they may be waiting a little bit too late to use it. And when they're using it, and this is the typical, often you see patients with the head back and sniffing really fast, if they're trying to sniff the whole bottle in at one go. And it's often, a very gentle, and, so we usually what we get patients to do is to just gently blow the nose to make sure it's clear, with your left hand for your right nostril, cross hand, so to speak. Gently just bend the head forward, nostril, and point the nostril towards your ear, so away from. Often patients are often pointed right. So you have to point it away from the side, so you instinctively think your nose is towards the middle. It's actually, most of the congestion is towards the side. Exactly.
It's the sinus.
Exactly. Yeah. So it's just a gentle, and it's just a very gentle sniff. If you're sniffing too fast, all it is the whole thing is just going back down your throat, and you get no benefit from it.
It's a bit like we had an item recently with asthmatics and using the inhaler properly. It's all well and good having the medication, but if you're not using it properly, you're not going to get the full effect from it.
Absolutely.
But interesting that you'd use the right hand for the left nostril and vice versa.
Yeah,
I don't think people would necessarily do that.
Yeah, it just makes it easier because it naturally points a little bit away when you use that.
And in terms of then how when I say we, I mean the family, say, around a hay fever sufferer, what can we do to help them? Are there little tips and tricks that we can do?
I think there are. So basically it's an allergy to pollen. So you're trying to reduce pollen exposure as much as you can. So what we say to people is, that pollen counts are often highest in sort of early morning and around at dusk, at noon, just after tea. So those are the times to try and avoid being outside if you can, if possible. Even things like drying the clothes. Pollen often attached to clothes if they're left out for the full day. So often bed clothes, etc. So your kids are being exposed to it.
And we're seeing, Dermot, in terms of inside the house, to keep fresh flowers out of the house, stop smoking in the home, vacuum and dust regularly, keep those dust and pollen levels down.
Absolutely, and that's really important. And then when you're out, little things like you're wearing wraparound sunglasses, trying to keep the pollen out of your eyes because stop the eyes. And little tip like even for kids going out playing soccer where they have to go out, a little bit of Vaseline just inside the nose. It tends to trap the pollen particles before they get in, causing all the symptoms.
And does that work for adults as well, Dermot? The Vaseline around the nostrils?
Yeah, it does. It's a very useful tip. Particularly if you have to go out, I think it's very useful.
It's also, I find, because one of our kids suffers with it really badly in the summer, you know, and it's very easy. It's not easier for an adult to stop scratching your eyes because you know it's harming you. But when you're watching your 7, 8-year-old and they're doing that, and you're saying stop, it's very hard to tell them. Isn't it? How can we help them?
Yeah, I think for adults you can say things like, even for all types of allergies, like even for eczema, rather than scratching, if you just gently push it and stuff like that. I think there's better medication. The medications have certainly improved. Things like the newer generation of antihistamines. The old ones used to wipe kids out, really make them tired. There's certainly some of the new prescription ones really work really well. And the kids shouldn't be. You're absolutely right. It's very different.
And there are off-the-shelf antihistamines that you can buy anyway and take. Yeah. We would give one of our kids a antihistamine going to school every day.
Yeah, and I think that's important to do that
all year round.
Every day.
Really?
Well, he would have allergies on top of everything. He doesn't suffer with hay fever, funny enough, but allergies, But he needs that every day.
Yeah, and it is for kids like that who have it all year round, it's usually house dust mite, and it's actually very difficult to actually reduce the exposure. The only way to say is to go and live in Switzerland at altitude where the
it is hard to avoid it. That's the thing, isn't it?
Yeah.
Even if it's not a blazingly hot summer. Pollen count can still be high.
Yeah, and so last year was quite a bad year for hay fever because we had that dry, warm summer. But the previous one before, the wet summer, rain tends to wash the pollen out of the environment, so it wasn't quite as bad.
Don't be praying for rain now,
No, don't do that. What about medication? Because quite often antihistamines can make you drowsy, so you do need to be careful around which brand you choose, don't you? Particularly if you're an adult and you need to drive or go to work or function.
Yeah, that's a very important point. And I think there's some of the new generation ones tend not to be sedating. Some people are very sensitive to them, so I think some people will take them and they'll really be absolutely zonked, and other patients can take them and not really have much problem. But if you're particularly the over-the-counter ones, if you find them making you tired, I think it's probably worth talking to your doctor, maybe getting one of the new generation prescription ones that tend not to cause sedation.
Because options are available.
Yeah.
Great advice. Thank you, Dermot, for coming in. Appreciate that.
Thank you, Dermot. Thank you.
Right, up next, he's known for saving lives on Bondi Beach, but the rescuing doesn't stop when the cameras aren't rolling. Bondi Rescue's Trent Maxwell will be here after the break. See you in a couple of minutes.